Right, so we're going to be going over the 5 R's for medication administration. So first off, the right patient. So Caitlin here, I believe, is suffering from cardiac ischemia. So we're going to be giving acetylsalicylic acid and nitroglycerin to counteract this. First off, we want the right dose. So for nitroglycerin, it's going to be 0.4 milligrams, and for acetylsalicylic acid, it's 162 milligrams. For right route, nitroglycerin will be sprayed underneath the tongue, sublingually, whereas acetylsalicylic acid will be taken orally and chewed and swallowed. For time, we're giving 1 dose of acetylsalicylic acid while we reassess every 5 minutes and re-administer nitroglycerin. For drug, I'll have my partner double check each drug to make sure it is not expired and is the proper drug. And that is your 5 R's.
Great, Caitlin, now that we've determined that your chest pain is due to cardiac ischemia, we're going to go ahead and start treating that. So you're prescribed ASA and nitro, correct?
Yes.
Okay, so this is what I see to be as ASA. Nate, if you could just double check that for me.
Yeah, of course. This is acetylsalicylic acid, 81 milligrams, expires September 2022.
Perfect, and we've got 2 of those guys. What is the dose for ASA?
So our dose is 162 milligrams.
And what are the contraindications we need to worry about?
Our contraindications, Caitlin, are you over the age of 18?
Yes.
Perfect. Are you able to chew and swallow for us today?
Yes.
Awesome. All right, do you have an allergy or sensitivity, ASA or NSAIDs?
No.
All right, perfect. And you're not asthmatic, are you?
No.
Okay, perfect. Don't have to worry about that either. Are you actively bleeding right now? Any blood in your stool, urine?
No.
Perfect. And have you hit your head in the past 24 hours or had a stroke?
No.
Perfect, which meets all of our indications.
Perfect. So as Nate mentioned, you're just going to take these, put them in your mouth, chew them up, and then swallow them.
Okay.
So you can go ahead and do that. And then before we start doing some nitroglycerin, we're going to have to get a 12 lead and rule out any ST elevations.
Okay.
All right, Nate. So we're just going to look here. Do you see any ST elevation in any of our leads?
I'm not seeing any ST elevation at all there, Kelly.
I agree with you. So we can proceed with nitroglycerin. So here's that. I'm reading it as nitroglycerin. Are you?
Yep, it says nitroglycerin, 400 milligrams, and it expires September 2022.
Beautiful. And what are our contraindications for nitro?
Well, our contraindications, Caitlin is over the age of 18, as previously stated. Her heart rate shown there is between 60 and 159, so we're good with that.
Perfect.
Her blood pressure was in normal tension range.
Perfect.
And she has a prior history of nitroglycerin use. Also, she has already used it. Are you allergic or sensitive to nitroglycerin at all?
No.
Perfect. Have you used any erectile dysfunction medication in the past 24 hours?
No.
Excellent, we're safe there. And we've ruled out right ventricle infarct.
Yes.
And we just want to be careful when doing nitro that when we do, the blood pressure doesn't drop by more than 1/3.
All right, so we will take more vitals after we've administered it. So before giving it to Caitlin, we're going to prime it, not shake it. Caitlin, if I could just get you to lift your tongue up, I'm going to spray this once underneath of your tongue, and then we're going to take more vitals. Don't swallow it at all. All right. So now we're just going to go ahead and get another set of vitals. Nate, do you mind getting into the front seat and heading to the hospital?
Yeah, of course. I'll head out the
Perfect.
side door here.
Thank you.